I'm Jamie, and this is my patient. Can you state your name and date of birth for me, please?
Sarah Johnson, 1/13/1990.
Very good. And we are going to be doing a head-to-toe assessment today. Are you okay to do that today?
Yes.
Very good. And do you know where you are today, Sarah?
Main Kiddo Clinic.
Very good. Patient is a positive mood affect, able to talk and speak clearly, alert and conscious and oriented. I'm going to start by palpating your scalp, just checking for any bumps, lesions, or tenderness. So just let me know. Cranium is round, no areas of bulging or depressions. No lumps or tenderness upon palpation. Patient has blonde hair, no flaking of the scalp, and it appears to be in good hygiene today. We're going to start by taking a blood pressure right away. Good. Patient's blood pressure on the right arm is 106/60. Check the left arm. Blood pressure on the left arm was 104/62. Grab the temperature. It's going to go across your forehead and behind your ear. Very good. 97.5. And we're just going to check a pulse here. Very good. Pulse was 66 on the right arm. We'll check the left. Good. 66 on the left as well. 16 for respirations, equal and bilateral. No retractions noted upon respirations. Female patient, Caucasian, white. Skin appears to be the same color throughout the body. We're going to check your sensation on your face to start with. Let me know if you can feel this.
Yes. Yes. Yes.
Light sensation felt in 3 different spots upon the face. Let me know if you can feel this.
Yes. Yes.
Yes. Good. Deep sensation felt upon the face. Facial cranial nerves are intact. And then we're gonna go ahead and smile for me. Puff out your cheeks. Raise your eyebrows. Wriggle your nose. Very good. Facial features are symmetric and bilateral equally. Facial nerves are intact. Let me know if you feel any pressure upon palpation. Just checking the temporal sinuses here. Any tenderness, palpation? No. And maxillary sinuses?
Mm-mm.
Very good. Go ahead and close your eyes for me. Skin appears to be intact on the eyes, complete closure. Eyelids touch each other. Eyelashes are long, no flaking. Eyebrows, there's no flaking upon eyebrows. No drainage noted from the inner or outer canthus on the eyes. Go ahead and open for me. Just going to take a peek inside here. Very good. Now pull up. Looks good. There's no yellowing or redness in the sclera or the conjunctiva, which is good. We're going to take a look at your corneas as well, okay? So you're going to see a bright light. Just going to look from the side. Good. Take a look at this one. Good. Corneas are bilateral round. Iris is blue in color with no discoloration or pigmentation. Then we're going to check your peripherals here, okay? So I'm going to have you go ahead and cover your left eye with that one. I'm going to cover my right. Let me know when you can see this.
Yep. Yep. Yep.
Very good. And then we'll cover the other one. And again.
Yep. 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 Yep.
Good. Thank you. And then I'm going to just have you follow my finger. Do not move your head, okay? Extraocular muscles of the eyes are intact, noted by able to follow my finger. No nystagmus noted. Okay. I'm just going to take a look at your nose here. Skin appears to be intact. No abrasions or lesions. Nasal appears to be midline. No deviation noted. We're going to take a look inside. Nasal cavity inside is deep and pink in mucosa. No deviation noted. Appears to be midline. I'm just going to palpate here. Any pain or tenderness upon palpation?
No.
Very good. No occlusions, no foreign objects inside of the nose. I'm going to have you close your eyes for me. And then let me know what you smell.
Coffee.
Very good. Olfactory cranial nerve is intact based on ability to smell. Then we're going to take a look at your lips here, okay? The lips appear to be pink in color with good borders, no crusting, no dryness noted. Go ahead and open for me. Good. Just take a peek. Let me grab some gloves. All right, go ahead and open. Good. Gum line appears to be straight. Teeth are in line, white with slight yellow coloring. Very good. You can go ahead and close for me. And then we're gonna take a look. All right, so go ahead and stick your tongue out and say ah.
Ah.
Good. Uvula is midline. Soft palate appears to rise bilaterally and equal, which is a good indication of an intact gag reflex. Can you stick your tongue out for me and move it up and down and side to side? Very good. Hypoglossal nerve is intact based on ability to move tongue in all directions. I'm just going to take a peek at your ears here. Feel some slight touch. Very good. Ears are consistent with skin color, slightly more pink than the rest of the face, which is normal. The top of the ears are hard upon palpation. The bottom are. So I'm going to go to the back of the room and whisper 3 words to you. You just repeat what I'm saying.
Plane, train, car. Bike, plane, train.
Very good. Let me know if you can hear this.
Yes. Yes.
I'm going to put this on top of your head. Let me know when you can't feel it anymore.
Okay.
Good. And I'm going to go behind your ear. Let me know when you can't feel it.
Okay.
Patient could hear the vibration in the back of the ear for 7 seconds, in the right ear and in front of the ear for 14 seconds. Patient was able to hear the vibration in the back of the ear on the left ear for 7 seconds and for 16 seconds in front of the ear. I'm going to have you step down off the bed here for me. We're just going to check a vision from you quick. If you want to just stand at the back of the room there. And then go ahead and cover your left eye for me. And then can you read this line?
E, D, F, C, Z, P.
And this one?
F, E, L, O, P, Z, D.
How about this one?
D, E, F, P, O, T, E, C.
Good.
L, E, F, O, D, P, C, T.
Good.
F, D, P, L, T, C, E, O.
Good. And then go ahead and cover your other eye for me. And with that left eye, can you read this line?
F, E, L, O, P, Z, D.
How about this one?
D, E, F, P, O, T, E, C.
This one?
L, E, F, O, D, P, C, T.
Good. With both eyes, can you read this line?
D, E, F, P, O, T, E, C.
This one?
L, E, F, O, D, P, C, T.
Good. Go ahead and have a seat back up on the bed. Patient was able to see at 20/15 in her right eye, 20/15 with her left eye, and 20/15 bilaterally with use of corrective lenses. All right, if you want to go ahead and just bend your head slightly forward for me, I'm just going to palpate the thyroid here. Let me know if you have any pain. No pain or tenderness?
No.
Good. No pain or tenderness felt with the thyroid. Thyroid was unpalpable, which is a normal finding. Trachea is midline. Upon palpation, just going to feel for your carotid arteries here. Carotid arteries are felt. I'm just going to listen for any bruise. No bruise are heard. Jugular veins are slightly, there's no distension in the jugular veins. Going to take a peek with the light. Okay. Slight palpation and bulging by the jugular veins, no distension noted. Slight bulging of the jugular vein on the left side, no distension noted, with slight pulsation. All right, so we're just going to check the muscle strength of your trapezius and your sternocleidomastoid muscles. So go ahead and turn your head against my hand as hard as you can. Keep going. Good. And this side. Good. And then push up. Very good. Patient is able to move against resistance with the trapezius and sternocleidomastoid muscles. We're going to just be checking range of motion here. If you want to go ahead and stand up for me. And then the first one, we're just going to have you raise your hands above your head. Good. Back down. Behind your back for external rotation. And behind your head for internal rotation. Very good. Go ahead and have a seat. And then if you want to just rest your hands on your legs there for me. Are you able to turn your hands over? Good. Pronation. Supination. Good. Any pain or tenderness with that?
No.
Okay, just going to feel your wrists here. Any pain or tenderness with that?
No.
Okay. And then go ahead and just put your elbows or arms straight out for me. Are you able to bend your elbows? Good. Extend. Rotate. Other way. Very good. We're going to just check a couple reflexes here. So I'm going to have you go ahead and just rest your arm up on my shoulder here. Very good. Go ahead and bend slightly. Good. Tricep reflex intact, noted by contraction of the tricep muscle. Again on this side. tricep muscle of the left arm intact, noted by a contraction of the tricep. And then we're just going to check your bicep here. Good. Bicep reflex intact, noted by flexion and contraction of the bicep muscle. Check your left arm here. Good. Left bicep muscle intact, noted by contraction and reflex of the bicep muscle. All right, and then hands are dry, smooth, no skin or lesions upon the arms when looking. No bruises, no contusions. Go ahead and put your hands straight out for me. Okay, and then go ahead and push your fingers out against my hands. Spread your fingers. Very good. And back in. Good. Are you able to, and then I want you to touch each finger to the thumb as fast as you can. Good. Okay, go ahead and close your eyes for me. And then I'm just going to have you put your wrist straight out. And let me know if you can feel this. Good. Yeah, good. Light sensation felt bilaterally. Yep. Good. Deep sensation felt bilaterally in the hands. Keep your eyes closed for me. I'm going to put something in your hand. Okay, and can you tell me what's in your hand? Quarter. Good. And then this one. Quarter. Very good. All right, so we're going to check the muscle strength of your triceps and your biceps. So go ahead and bend for me. And then I want you to pull in as tight as you can against my hand. Good. And again. Good. And then go ahead and push. Good. Checking triceps here. Good. All right. So what I'm going to have you do for me is I'm just going to have you rotate just a little bit this direction. We're going to take a look at the posterior side here. Posterior muscles, is it okay if I just pull this down a little bit? Good. Posterior muscles are equal and bilateral. And then go ahead and take a deep breath for me here. Good. Hands rotate externally, indicating that there is adequate lungs. And then go ahead and say 1, 2, 3 for me.
1, 2, 3.
Good. Checking tactile formitis there. Resonance felt, no over-resonance, no pain or bulging in the back there. All right, I'm going to take a listen to your lungs. Deep breath for me. Good. Lung sounds are clear, no rhonchi or wheezing heard in either side of the lungs. Okay. And then I'm just gonna press your back here for me. Let me know if you have any pain with it. Any pain? No? Okay, good. Just slight dullness heard upon palpation. Just going to check the kidneys here. Any pain? No? No. Okay. No pain indicates no indication of a kidney infection or nephrolithiasis in the kidneys. Okay, you can go ahead and turn for me again. And breathe normal for me. We're just going to take a look at the anterior side of the chest here. Good. Chest rises and falls equal and bilaterally. Just going to check chest expansion here, okay? So go ahead, deep breath in. Good. Fingers move apart externally, indicating adequate lung compensation there. Go ahead and say 1, 2, 3.
1, 2, 3.
Good. Checking tactile formitis there. Resonance felt. No increase in resonance means that there's absence of lung consolidation, no pleural effusion or atelectasis. Going to take a listen to your heart here. and take a deep breath and hold it for me. Good, let it go. Good, let it go. And deep breath. Good, let it go. Deep breath. Good, let it go. Good, let it go. Just gonna listen to the apical pulse here. Good. 66 for a pulse heard at the apical. Go ahead and lay back for me. And I can keep your feet straight out. I'm going to take a listen to the bowel sounds here. Good. All sounds are heard on all 4 quadrants. I'm just going to palpate here. Let me know if you have any pain or tenderness. No. Good. A little bit deeper.
No pain.
No pain, no tenderness. Good. No mass is felt upon palpation. I'm just going to tap here a little bit. Good. No dullness heard upon tapping the stomach, indicating no obstruction or constipation. Just going to take a listen for any bruise. Good. No abdominal bruise heard. Do you have any pain or tenderness? Any pain and tenderness?
No, nothing go.
Okay, good. Go ahead and push against my leg. Good. And pull back. Checking hamstrings there. Go ahead and pull towards my hand. Good. And push. Checking quadricep muscles. Very good. Go ahead and lay back for me. We're going to check range of motion of your hip. So what I want you to do is go ahead and pull your left leg in as close to you as you can. Good. And then the other leg. Good. And then go ahead and raise both legs straight up for me. Oh, geez. There you go. Perfect. And swing one leg out for me and back in. And then the other one and back in. Go ahead and put your heel to your knee for me. And then bring out just a little bit. There you go. And run it down your leg there. Good. And then the other leg. Very good. Just going to feel the femoral arteries here, okay? Very good. And I'm just going to check the lymph nodes here. No lymph nodes felt in the inguinal areas. Go ahead and sit back up for me. We're going to check your reflexes. So go ahead and relax as much as possible here. Good. Popliteal reflex felt, indicated by flexion of the lower leg. And again. Good. Popliteal reflex intact, indicated by flexion of the lower extremity on the left leg as well. Going to check the ankle here. Good. Achilles tendon intact. Good. And then what I want you to do for me is bring your toes straight up for flexion and back down for dorsiflexion. Very good. And then go ahead and stand up for me. And then I want you to roll your toes, your pinky toes to touch the floor. Perfect. And then your big toes to touch the floor. Very good. Go ahead and have a seat. And I'm just going to check for tibial pulses here. Good. Tibial pulses felt equal bilaterally. indicating good circulation and pedal pulses. Pedal pulses were felt equal and bilateral. And then I'm just going to run something under your foot here. Go ahead and close your eyes for me and let me know if you can feel this.
Yes.
Okay. Yes. Good. And again. Yep. Very good. Yep. Perfect. All right. Just one more thing here. I'm going to have you lay on your stomach. And I'm going to have you bring your legs straight up for me. Just checking those hips again. Good. And I'm just going to check for palpatio pulses. Good. Palpatio pulse felt bilateral and equal. You can go ahead and roll back over for me here. And then go ahead and stand up for me. I'm just going to push this in. I'll just step down. Perfect. And then go ahead and tilt your head to your chin to your chest and back. Perfect. And then side, side. Very good. And then this way. Good. Range of motion of neck is good. Go ahead and bend down and touch your toes. Good. And then go ahead and bend all the way back as far as you can for me. Checking hyperextension of the back. Perfect. And then side to side. And then go ahead and rotate for me. Perfect. And then if you could just walk to that side of the room, just checking your gait. And back, heel to toe. Perfect. And then go ahead and close your eyes for me. Very good. And then stand on one leg with your eyes closed. Good. No swaying noted, indication of good balance. Okay. And then if you want to just raise your arm above your head for me, just going to check your axillary lymph nodes here. Good. No axillary lymph nodes felt in the right arm. No axillary lymph nodes felt in the left arm. Just a little education for you. Females should be doing breast self-examination. In order to do that, what you'll do is stand in front of a mirror, raise your hand above your head for you, and then you're going to start with a circular motion starting around the nipples and working your way out, just feeling for any tenderness or masses. If my patient was a male, I would have educated him on self-testicular exams. That includes monthly exams of just taking between the finger pads and the thumb and rolling around up and down in a circular motion of the scrotum, checking for any tenderness or masses. And that concludes our head to toe assessment today. Thank you for my patient for assisting.